Welcome back to America Can We Talk? This is Debbie Georgatos. I'm so glad you've tuned in tonight. You know, I meant in the last segment to have a little time to give introduction to our guest tonight. And as many of you know, listen to the show, I love think tanks. And as many of them now say, they are think tanks and do tanks. They have experts, they come up with policies, and they try to help policymakers understand them, understand the repercussions of policy that are in place and how to improve them. So you may not recall this because it seems with all the Islamic terrorism and the Black Lives Matter movement and the killing of police officers and the conventions, you may have lost track of the fact that one of the central goals of the conservative movement has been to eliminate or at least to get rid of the really onerous impact of many of the provisions of Obamacare. So that's why we have as a guest tonight on the show, we have Dr. Devon Herrick. He is with the National Center for Policy Analysis, one of our advertisers. Love these think tanks. And he is extremely qualified. He's an expert on all sorts of issues related to medical care in the 21st century and how we deliver it and how we can make it better. So, hello, Devon.
Well, thanks for having me.
I'm so glad you're here. Well, I'm going to jump right in because, as I told you, we talked earlier today, these segments go by. It just seems like there's something wrong with the clocks out here or something that goes by so fast. So I want to jump in and say this. President Obama had an overview published of the results of Obamacare in the Journal of the American Medical Association. This was just this month, July of 2016. He had an overview of kind of where we are with Obamacare. One of the things that the author of the article was commenting on was that President Obama is largely acknowledging that Obamacare is at least financially failing. It's basically failed because for a variety of reasons, it doesn't have enough funding. The people who are the most ill are the ones who need the most help, and it has all sorts of problems to it. So I just want to jump past the problems for a second and ask you something, because this author wrote, essentially, he thought the goal of the Obamacare bill was to just get rid of private health care, get rid of private health insurance. And I'm not asking you can agree or not on that, but he said the goal is to smash the private health care system with the goal of creating single payer. So do you agree with this guy that there is a concern that with so much damage has been done to the private healthcare insurance industry and the private healthcare system that the government succeeded in destroying it? We're just going to have to surrender to single payer.
Well, I do agree that if we don't reform healthcare now, that indeed in maybe a decade, possibly more, Americans will throw their hands up and accept a public plan option, as they call it, whereas nobody would 6 years ago. So that is a very real risk. Now, and I've been asked this question quite a bit over the last few years. Did the Democrats really think that Obamacare would work? I think most of them probably naively did. Now, there may have been a few that quietly knew it wouldn't, and maybe they went along just figuring they'd get in the end, they would get their agenda. But yeah, there's really no time left. We have to fix our individual insurance market is in tatters. I mean, if you've gone out to price the premiums for individual coverage in Texas especially, but elsewhere is very similar. They are unaffordable for people who are not getting subsidies.
Yeah, I do want to talk a little bit more about the reasons, the lessons learned from Obamacare. But, I would say in the question of whether the architects of it intended it to fail, I remember so clearly when Obamacare was being discussed in Congress, and there was some woman elected, a member of Congress from, I don't know who she was, but anyway, she gave a little press conference where she essentially said, I thought I would be against Obamacare because I really don't think the government should control health care. But once President Obama he promised that we're going to have better care and lower rates and it would save money. Now I'm for it. And you're thinking, what did he promise you the moon too? So, you know what I will say, I think I will agree with you that there are many legislators that kind of said, well, maybe it's going to work. I think, though, the thinking behind it, the people who've wanted for decades to have socialized medicine in America, we don't have to discuss it further. I will say their motives, I'm pretty clear. We're just, this was unaffordably, it was unworkable, it was too complex, it caused confusion, and to me, their sense was just make something that can't work. But whatever, I think that I agree with a lot of innocent people who went along with it because they never thought it through enough to realize what would happen. Okay, so tell me, what are the basic reasons Obamacare is failing? This whole idea of exchanges. What are the faults in the system?
Well, the fault in the system is it changes the way insurance is regulated. By doing that, essentially they're saying you can wait until you're sick to sign up. Yeah, there's a mandate, but really there's no teeth in the mandate. And then of course insurance companies are required to cover all who apply, regardless of pre-existing conditions. And the law, the Affordable Care Act, which is a badly named law, obviously.
Yeah.
Also, it did away with all caps on benefits. Before, if you were a modest wage, modest income family, you could choose a flexible policy that had limited benefits, some cap at some point, and that was fine for most families. By design, Obamacare is meant to make health insurance a bad deal for most people, in order for that very small segment of the population that's very high cost, that they get highly subsidized health care. And the trouble with that is people that are a good risk, who have healthy lifestyles, they don't want to do that. They bail out of the market. They leave the market. They find other options. They pay the fine because it's cheaper. And, of course, it's just untenable. The cost of, health insurers are losing money left and right. They're leaving entire markets, all the while premiums for a family are higher than their mortgage.
Okay, so I want to be sure our listeners are following this, and frankly, I want to make sure I'm following it too. The problem in part is that the people who are most likely to have the most expensive care are the ones remaining in Obamacare or the Affordable Care Act policies, the health insurance exchanges, and the people who are healthy and do not anticipate high expenses would rather pay a fine and pull out of the system. So the ones remaining in the system are going to be exceptionally expensive, and most of them are getting assistance with the cost of their premium. Is that right?
Oh, absolutely. 83% of those who are enrolled in the exchange plans are those getting subsidies, which basically means the middle class who are not getting subsidies, they cannot afford Obamacare, so they are maybe getting a job that offers coverage, or they're just avoiding coverage. Maybe hoping they won't get caught, or maybe they are using one of these care and share, ministries.
Well, it's a funny thing. I'm going to have a guest on the show in a few weeks who lived in Canada, and she had a horrible experience in their healthcare system. And she's just going to try to give a firsthand picture of the misery inflicted by the single-payer system, and which must inherently, eventually, it must cap care. That's part of what happens is you simply can't get the care you need because it's not provided and you have nowhere to go. So I think we all know in America that's not our goal. We don't want to be Canada or England, so we need to do something with Obamacare. And I love that your think tank, and again, we're speaking tonight with Dr. Devon Herrick, who is a senior fellow at the National Center for Policy Analysis, and he's talking about alternatives to Obamacare. And this has been or the Affordable Care Act. This has been a subject in many, many different conversations, but you at the NCPA have started at least trying to think through what should you do to fix Obamacare. So we have about a minute and a half in this segment left. Can you give an overview of kind of the themes of what you want to do to fix Obamacare? When we come back after the break, we'll dive in. So what are the overall themes you're trying to do?
Well, the overall themes is to repeal Obamacare in its entirety and replace it with flexible coverage. Let Americans buy what they want to buy in terms of health insurance. Allow individuals fairness in whether they get their coverage through work or individually. Expand America's access to primary care. Reform hospital care to better serve patients. Expand price transparency. Reform the practice of medicine to allow individuals to see the doctors or the nurse practitioners or whatever they want to do. Of course, malpractice reform. Expanding care coordination. If we can't care for the most sick patients better, we can never reduce our spending.
Okay, so we still have a minute here, or a little less than a minute, but in the plan that you contemplate, what is the vehicle to care for those who truly cannot afford insurance and need something? Is there a summary way you can describe that in 30 seconds?
Oh, yeah. I would think a risk-based tax credit, giving those to allow individuals to buy or to help individuals buy coverage, and guarantee renewability. So if you get sick while you have coverage, you can't get kicked off of your coverage. But also high risk pools for those who are truly, cannot, to become ill and for no reason, fault of their own, just cannot get health insurance through traditional commercial markets. Those are typically state subsidized. And just better care for the sickest patients.
Okay. Yeah, I'm going to jump in here because we have 5 seconds to our break. We're talking with Dr. Devon Herrick, who's a senior fellow at National Center for Policy Analysis, about how we're going to fix Obamacare. I love when smart people think about solving our biggest problems. So right after the break, we'll continue talking to him. And you can be smart to tell your friends we can find a better deal than Obamacare. Come right back. And welcome back. This is America Can We Talk? This is Debbie Georgatos, and I'm speaking with Dr. Devon Herrick of the National Center for Policy Analysis. And way back before the latest chaos in America was happening, many of the prevailing think tanks were trying to think through how can we do something better than Obamacare, which has been such a dismal failure. In fact, back before I forget to say this, part of what the report that President Obama gave, which was he published an overview of the results of Obamacare in the Journal of the American Medical Association. President Obama had this published. He acknowledged in there that many of there are, even though he says it's wonderful and all that, he also talks about many of the remaining uninsured individuals want coverage. They're still unable to afford it. They may be unaware of financial assistance. They need more money. Got to put more money into this. So Obamacare, we could have another whole show just about why it failed and how it failed. But even President Obama, if he's being as honest as a big government guy can be, to say it's a disaster. And so brilliant people like our guest tonight, Dr. Devon Herrick and others, are thinking through what do you do in a country where you want to provide health care you want to make sure that the poorest among us have health care or health insurance, whatever you provide for them, but you mostly want to have free market principles and competition. Or I guess I should ask you as a question, is part of what you think is a solution is to introduce more kind of free market and competition in the provision of health care?
Oh, absolutely. There's only two ways of controlling cost and prices. That's government bureaucrats making decisions for you like they do in Canada, or consumers. In every other market where we shop and buy goods and services, consumers are the ones that tell the merchants, no, I will not pay that price. I will look around. I'll find something cheaper somewhere else. And that collective shopping, asking questions, is really what holds prices down in every other market, and it works in healthcare as well. I mean, the research goes back into the 70s. The Rand Health Insurance Experiment found when people were exposed to significant cost sharing, they consumed about 30% less medical care in terms of the cost, and it did not adversely affect their health. And it's true in healthcare today. If, for example, I've talked to people who needed MRIs and CAT scans. Well, the price varies. You can go to a hospital and spend $3,000, or you can go to a freestanding radiology clinic and spend $300 to $400. And
wow.
If you have questions, and it's true of drugs, it's true of all kinds of services. The one place that's not very easy is in the hospital, but that raises another issue. 5% of patients consume, or Americans, you could say, consume half of all healthcare dollars. If we don't get a handle and better care for those individuals, we can never reduce our spending. So the NCPA's healthcare agenda involves care coordination, better care for the sickest patients, and the way to do that really is to keep people out of the hospital. That's the most expensive place to receive care.
Yeah, they use that shorthand expression about Obamacare that people will stop running to the emergency room for, heavy cold or something that you wouldn't normally go there for. And I know hospitals, having recently had family members in the hospital, I know that's astoundingly expensive. But how do you keep them? What do you do to stop the person from running to the ER every time they have a heavy cold?
Well, the way you keep people out of the emergency room is to make it financially costly for them. Cost sharing. If you look at ER usage, and there's been a lot of research on this, the common denominator is those who have public coverage. like Medicare and Medicaid, they're far more apt. I mean, I can't think of the stats off the top of my head, but even the uninsured go to the ER less than people with Medicaid by like near a factor of 2. I mean, you're twice as apt to go to the ER if you have Medicaid as if you have private insurance, and about that same amount if you are uninsured. And the reason is because, first off, doctors don't really like to see Medicaid enrollees because, hey, it doesn't really compensate them very well. And to some degree, that's also true of seniors. Medicare does not pay doctors as much. And so oftentimes, if you have a health problem on weekends, after hours, and you're on Medicaid or Medicare, that's your option. Plus, if you're not paying the bill yourself, hey, why not? So I think it's important to really teach people that, A, it's going to cost you some money, and B, you do need better options. I mean, there's urgent care centers. There are doc in the box. There's retail clinics and like CVS Minute clinics, for example. There are other options, and if you explore these before you get sick, then you'll have a place to go if you have something that happens like an asthma attack in the middle of the night.
I just love all that you're saying. I love the notion of competition and putting it back in the hands of the patient where someone's thinking, well, I know I need some attention, and if it just seems free, I'm going to zip off to the ER because everything I get here is covered. But if it feels like, I'm going to have to pay something for this, let me give it just a moment's thought. Could I just go to the doc in the box around the corner? Is that good enough? Or what's the level of concern I have? I love introducing every individual American's sense of responsibility about what they need and what it really costs. And it has to cost something. I think that's all brilliant. I want to shift, though, and ask you about something else. Among the biggest complaints about Obamacare is the employer mandate and the individual mandate, the basic notion that you're being forced by the government. And this is my thing I'm always off on the Obamacare is the mandate I must buy insurance is not a role of the government. It just shouldn't be the government's job. But do you think we can do the kind of reforms, getting around and getting a new system, getting rid of the Affordable Care Act? Can we do that without the mandates, or is that somehow too interwoven and we're just stuck with that idea in our society?
Well, I do not support a mandate. If the only mandate that I would ever support would be a mandate that individuals must set money aside, toward their own health care, kind of like they do in Singapore. But I think more Americans would buy coverage and they could afford that coverage if we allowed them to have the flexibility, our insurance companies, the flexibility to offer the kind of coverage Americans want. That's the main thing that Obamacare took away was insurance flexibility. Bureaucrats in Washington designed our health plans. They're very costly. They're very regulated. And even in middle-class families who lack coverage through work can't really afford the individual coverage anymore. So the important thing is let insurers create policies consumers want to buy and can afford to buy. And that may mean, of course, those policies are devoid of all the Obamacare regulations that drive up the cost of coverage.
I'm so grateful for people like you, I have to tell you, because I would not be good at this job that you do. I would not be good at trying to sort through the competing concerns and interests and costs. And I just am thrilled that someone like you is focusing on all this. And you're doing it through the National Center for Policy Analysis. And you all have come up, I don't know if you call it what you've come up with an entire plan to replace Obamacare, but you've certainly come up with the themes you mentioned a moment ago, and which I loved. And so my next question is, are you bringing these to Washington? Are you working with people in Washington to share these ideas and say this is what we could do? Because I think a lot of legislators, they're afraid of repealing Obamacare or even touching it unless they can show I have something really solid to replace it with.
Oh, absolutely. We have published a congressional brief, which is the NCPA's health reform agenda. We have representatives in Washington whose job it is to be a liaison with Capitol Hill. They, of course, do desk side visits with members of Congress. They go and visit and talk to the legislative staff, legislative assistants. We hold briefings when we can. So, it's publishing an agenda that no one ever hears about, especially policymakers, would have no effect. But, it's our job to give ideas to members of Congress that they can take and run with. If we didn't, it would just be an academic exercise that would serve no purpose. So yeah, of course for many years we have, I've met with members of Congress, I've testified before Congress on several occasions, and it's really helps to have the outreach.
You mentioned earlier today, we talked on the phone briefly, that you also are a prolific writer, which is a wonderful thing, too. You have a column coming out in Town Hall, and I believe it's talking about the insurers pulling out of Obamacare. Can you explain what you're writing about, and you can direct our listeners to where they can go and read it?
Well, it's townhall.com. It'll appear tomorrow. And it's essentially just explaining that, Obamacare is a failure. It's not even a question anymore. When will Congress finally put it out of its misery? Because the issue is premiums are sky high. In Texas, there are some premiums that will rise 60% in 2016. Blue Cross has pulled out of New Mexico. I think United Health Group is pulling out of numerous markets. I mean, just think about this. The premiums are unaffordable. They're sky high. They're rising at double digits. Yet the insurance companies are losing so much money that they're saying, we don't want to be in this business anymore, at least not in the individual market. So I had a reporter ask me just a couple of weeks ago what that meant. And I said, it means it's a failing.
To summarize, yes. Yes. It's failing. We're speaking with Dr. Devon Herrick, who is a senior fellow at the National Center for Policy Analysis. There is on your website, the NCPA, is it ncpa.org, right?
That is correct.
I would urge our listeners to go and read this one-pager. They have a lot of, that is a great website, ncpa.org. They have a lot of research there on all sorts of topics, on the particular topic of tonight of Obamacare and ideas of how to replace it and make it better, make the healthcare system better. There's loads of material. So I urge you to go there. Dr. Herrick, I want to thank you for calling in so very much.
Well, thanks for having me.
And we were speaking there with Dr. Devon Herrick, who is with the NCPA, one of our advertisers. Love NCPA. And I want to take a minute because we're going to go off to a break in our second hour.